Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who've heard my content in the past. If you want to know about when joint manipulations go wrong and what to do to avoid this from happening to you, you need to tune into this episode. Before I go on to the podcast, what is new? What is better in life? I just finished a great weekend of leadership development and a great weekend with my family, which was fantastic. For those of you on the podcast who don't know, I enjoy taking 2 or 3, 4 day weekends with the family quite often. And what this does is it just it forces you out of the routine. It gets you to think a little bit more clearly. Are you on the right path? What do you love about everything you're doing? What don't you? It just gives you clarity. It gives you time to just relax, spend time with the ones that you love, and just be present and enjoy that time. So I enjoy the getaways. So it's fantastic. And back to everything now. So my kids are good. It was just a good time to reconnect with them and just listen to everything that they have to say. And I learned about my son is into YouTube and Mr. Beast, and my daughter is all about being an artist at the moment. So yeah, just refreshed and ready to rock and roll. Fitness wise, I'm back on it. I'm enjoying every minute of it. My calf is definitely feeling better. Yeah, so just right back into the routine, which is great. So onto this podcast. Why are we talking about joint manipulations? Now we all do them. We all do some form of grade 4 or 5 mobilizations and manipulations, whatever you want to call it. The interesting thing is, you do them until you flare someone up. And how do you know where that fine line exists? Well, I'm going to tell you some stories about how grade 5 manipulations have seriously injured individuals and even caused surgery inside this episode. And I want you to understand what to do, what not to do, and when not to do them. And that is literally everything we're covering in here. So if you are a manual therapist, you enjoy grade 5 mobilizations, or you don't do them very often, and you want to know when you should and shouldn't, besides all the classification criteria, what else is out there? What do I need to be aware of? What are the risks? So I'm going to share 3 case studies of pro athletes that I personally know that have gone through these scenarios. And I've been exposed to this in my career. These are pro athletes. These are professional athletes who get paid for a living to perform, and the healthcare professionals that flared them up. If you don't know my take on treatment, I used to be a very aggressive physical therapist. Now I find myself more conservative. I'm a very aggressive manual therapist, but in terms of my progressions, I'm very calculated on my percentages. I'm very calculated on my timelines. And with that, I know I risk so much more if I am that aggressive physical therapist. And I'm going to share the stories of people who chose to be a little bit more aggressive with their treatment style and how that went wrong. And what I want you to take away from this is not necessarily like these are all individual cases, and you may or may not ever see these type of patients, or you might work in a different scenario, but you're going to take away the logic, the reasoning, the critical thinking on what you can apply inside your practice with the people that you see. Would you have done this? Would you have been guilty of this one? Would you have backed off? Would you have waited at day 7, day 3, day 8, day 12? What criteria would you have done? That's where I want your brain. So listen to the stories, find yourself inside them, and figure out what you have done any differently. So, number one. All right. So this was a professional thrower, and they were an overhead athlete, and they had an event, an international event, within that week. And this person was, I think, 5 to 7 days away from competing. And anytime that you travel internationally, for those you don't know, I've traveled as a concierge physical therapist for elite athletes for about 3 years. And during that time, I traveled domestically and internationally. And I learned a lot about when to apply certain techniques, especially as people approach events or competitions, because that timeline is very different than when you're in the clinic. So this person was 5 to 7 days out, and they're an overhead thrower. And when you travel internationally or domestically, when you go to an event, maybe that's a baseball field or soccer field or BMX course, whatever it is, these individuals don't always travel with their own medical provider. It's a large budget, large expense. And so they find themselves stuck where they don't know who to ask for help. A lot of these events, they'll have a medical staff in a tent or in a clinic where you can go and use them as needed. But it's a risk because as an athlete, you've trained for a year, 2 years, 3 years, 4 years, and you are now trusting somebody's care on the week of your event, somebody you don't know. So if they're a massage therapist, an athletic trainer, a chiropractor, a physical therapist, an acupuncturist, you don't know their style of treatment. So you have to be very particular about, well, who do I trust? So this athlete had seen this person 1 or 2 times before, and it was 5 to 7 days out, and they had some posterior shoulder tightness. And the healthcare professional said, "Yeah, I can definitely adjust that. I'm going to do." They brought their humerus into 90 degrees of flexion. They bent their elbow. The athlete was sitting down, and the person stood behind them and grabbed their elbow and applied a grade 5 mobilization anterior to posterior of the humerus into the glenohumeral joint. And it's a very common adjustment or mobilization, and I'd seen it done before, and I didn't think anything of it. And within a day, the athlete says, My shoulder feels odd. It's very clicky. It wasn't like that before. And now I can't even throw." We're like, "Oh, that's weird. What happened?" We didn't attribute it to the adjustment or mobilization. They're like, "I didn't even practice today, so that's odd." And we did this timeline, and we realized, gosh, it was within an hour or two of being adjusted. So we go back to the clinic, we look at it. And this person is able to throw but not compete at anywhere near their best, so they're pretty pissed off. And it was not because they didn't have the technique, it's because they physically weren't able to because of the shoulder. And mind you, they were coming into the medical tent not because they couldn't throw, is because they wanted just a little, like TLC, a little love on the shoulder, right? No pain. And after being adjusted, they had significant pain, and it was grade 5. And when we flew home from going international, we did a full workup and an MRI, and we discovered that this person had a labral tear, a glenohumeral labral tear. And you might say, well, that could have been pre-existing and all those things. But what we realized is now that labral tear was limiting their ability to sleep, to do all things normal. And the only thing that changed was this mobilization. And in my head, and obviously this person was pretty frustrated. They're in the middle of the season, and now they have to discontinue what they love because of somebody else's mistake, a medical professional who they trusted. And it was decided that this person was probably a better candidate to be able to go to surgery. So they had a slap repair, and 9 months later, they were able to throw again. But I still remember the story because I remember the timeline. I remember everything about this case, and I remember, if that were me, what would I have done? What would you have done? Would you have done anything different? On the week of competition, do you do a grade 5 glenohumeral mobilization? Maybe. Would you have done anything different? Would you have gone lighter? Would you have gone more aggressive? What would you have done any differently? Would you have just done, manual therapy and like grade 1s, 2s, 3s, 4s? What's a grade 5 necessary? In either case, now your hindsight is 2020. So what would you have done any differently? And That's the question you have to ask yourself. What was warranted? What wasn't? If it was me, I wouldn't have done the grade 5. I would have done, sure, grade 4 plus going into it, right? Just something real light. But what I realized with working with pro athletes, they don't like to be touched too much right before an event. And what I mean by that is, you have to think about it. The whole reason they're competing, the main thing that is being primed, that is being monitored, and that's being stimulated is their central nervous system in any sport. And so, as their central nervous system is being primed, you don't want to loosen them up too much, right? You don't want to stretch them too much. You don't want to yeah, they can have a massage, but they're probably going to have a sports massage. You don't want to dampen their central nervous system. And so with this athlete, I don't know if I would have done that. I would have done maybe a little soft tissue, a little bit of taping, sure, grade 5 thrusts, maybe T-spine, cervical, hips, low back, whatever it was for their sport, since they're an overhead athlete. But I don't know if I would have done the glenohumeral. Now, for you in your clinical practice, there's two things to take away. Is it necessary? And number two, is this appropriate inside their timeline? So that's the first case with my overhead thrower. Number two is a sprinter. So this was an international event as well. We have a 200-meter sprinter on the day of the event. That's the difference between case study 1, overhead thrower. Number 2 is a 200-meter sprinter on the day of the event. So you ask, okay, what would you do on an athlete the day of the event? Like, what purpose do you serve? That's the question. So we have a 200-meter runner who woke up with lumbar tightness, a little SI lumbar strain, and they don't feel really good. When you start to work with track and field athletes, they're very aware of their body, right? They're just like, my big toe doesn't feel right. My QL's a little off. My right 10th rib is tight. Whatever it is, they always have something, right? And they're very aware, and it's because their event is so short that everything has to be as good as possible. So this person wakes up, and this is around 9 or 10 in the medical tent. They say, hey, can somebody help me with my lumbar tightness? I go at 1 o'clock. I have a couple hours. Can somebody work on me? Yeah, no problem. When somebody else takes them on, and they get on the table, start working on them, and they do a sideline lumbar roll, right? Sideline thrust. A little bit to the SI and a little bit to the lumbar spine. They do CT junction. They do high cervical. They do lumbar, or excuse me, thoracic. And the athlete moves a little slow after the sideline adjustment. And they slowly get up, and they're a little slow to move. And I come over and I check on them. I'm like, hey, what's going on? They said, I don't like that adjustment. I don't really do well with it. And he went a little hard. And I said, I see. And so here I am. It's like 9:30 in the morning. And now you have an athlete who competes in 3.5 hours. What do you do with this individual? Nonetheless, we were able to calm him down. He didn't compete at his best. But as a medical professional, as a physical therapist, you see these things happen. And was the sideline lumbar roll necessary on the day of the event? This healthcare professional decided that despite this person not having a positive outcome with lumbar rolls in the past, they went through with it because that's what they thought they needed. Would you have done that? Was that necessary? If I were in those shoes, in hindsight, I would have put them in that position. And I like to see people gently go into it. I won't force it. I won't crank, and I don't have a large superior to inferior force. Yeah, you roll them into it, but I don't think that you adjust them and you apply a large force, maybe a small amplitude. And this person, out of principle, still went through with it, even though the athlete had acknowledged that they don't do well with it. On the day of an event, here's the tricky part. Hindsight's 2020, and a lot of times you have athletes who have a lot of nerves going into an event. They need security, they need confidence. And so as a healthcare professional, I feel like, oh, I've done this 1,000 times, and you do it to them, they trust you. Well, here's the problem. If you've done it 1,000 times in the clinic to somebody who is not competing in 3 hours, you don't have the right to say, I've done this 1,000 times. How many times have you done it to people on the day of the event within hours? If you say zero, why would you do it? Now, if it was 2, 3, 5, 10, 14 days before, and you've done that before in the clinic, then you stick with that routine. And this person now had to suffer, and they didn't have the results they wanted. Think about this. People put their time, energy, life into training. They're paid for this. And all because one person decided to be a little bit more aggressive. And what I've realized with healthcare professionals, especially when they have an opportunity to be in the spotlight, they are at a national or international event, high caliber, high profile. They too want to be in the profile, in the lights, in the stardom. I was the person who adjusted this person. I was the person who did this. That you're the reason why I performed well. That's a very selfish healthcare provider. And after working in pro sports, I saw it all the time. People who are either volunteers or they finally reached that podium. They pro athletes, the high sport, the Super Bowl, the whatever event. They want to be the superstar. And that's a very young, immature healthcare professional. And it's because you let the emotion take over. You saw the glitz and the glamour. You went with it. You're like, I'm going to do it. When you realize that athletes have probably competed and trained for years or the entire year, and you happen to be a healthcare professional at the event. That's like somebody asking at a marathon who you've never treated before, hey, can you take care of my hip? It's a little tight. You don't do this game-changing technique to somebody who's about to compete, especially if you didn't have to do anything with their 3 to 6 months of preparation leading up to this. And that's what I find with healthcare professionals. They don't take that into account. You weren't part of their strategy. You weren't part of their planning and preparation that led up to this. So you don't know if they have a history of these things. You don't know how their body responds to these techniques. You never had that time to adjust to it. So how can you apply these things on the day of an event, on the weekend of an event, if you never even knew how they responded? And that's a healthcare professional, a physical therapist who takes into account a situation, situational awareness. You have that. That's so powerful. Do I need this? Is it necessary? Is this the right time? Is it appropriate? Is your ego going to be hurt if you're not the game-changing PT? I can tell you right now, you don't need to be the game-changing PT. You need to be the PT who did their job and help support somebody accomplish the thing that they wanted to. And finally, when you have that limelight, you have that opportunity, that is not the time to change everything you've ever done and work with people. And you only do it because you get everything is overridden with the lights and the opportunity. Have I done it before? Yes. Early in my career. And then I just saw people mess up athletes back to back to back. So anytime I mentor physical therapists, I have to see where they are. What experience have they had on game day, on the week of? If you haven't, you have to approach very conservatively. And situational awareness, timeline awareness. What would you have done? Don't be the game-changing PT if you've never game-changed with anybody in that type of scenario. It's not fair to the athlete. Our medical ethos is do no harm. And you are doing harm by doing that. And these two healthcare professionals did that. So that's case study number 2. Case study number 3 is a professional athlete, elite level heptathlete that competed, I think, within 7 to 10 days. And they saw a healthcare professional and a very educated, well-rounded healthcare professional. And this is an interesting story here. Athlete competes in 5 to 7 days. They come in with lumbar SIJ pain. And they had been seen by this medical professional, and they say, hey, my back's feeling tight. Can you work on me? Yeah. And they go through the screen. They do tissue work, corrective exercises, taping, all the above. And then they ask them, are you okay with doing adjustments or grade 5 mobilizations? Yeah, I've done them before, no problems. They did a sideline lumbar roll, did an SIJ manipulation and supine. And then they also did a supine caudal distraction, grade 5. and to bilaterally to both sides because they were having hip pinching or sorry, they were having limited hip mobility, and that's what was causing a little bit of lumbar flexion when they squat. So it was decided that they were going to do a caudal hip distraction, and everything turned out great. They squat, they lumbar flex, they move all, and they do movement testing. And the next day, the athlete reports, "Hey, my right hip is pinchy, and it wasn't pinchy before." And he says, "I think it's because of manipulation." And you're 5 to 7 days out, and we say, "Okay, let's just monitor." They end up trying to run through it, and now because it's their hip and it's pinchy, it's a little bit of labral pathology. Now it hurts to go into hip extension every single time. So as they go into hip extension, they're unable to compete with this. And so what happens at this point is you have to decide what you're going to do. Do you manage them conservatively? Do you readjust? Do you leave it alone? What do you do for the next 5 to 7 days before they compete? So that's the type of scenario this person found them in. What do I do? Do I readjust this? Do I flare it up? Do I do nothing and hope that it feels better? And you put yourself in a position where you don't need to be there. And so this scenario is tough because let's go through this. If it were me, would I have done anything differently? I don't know if I would have, because I think that a lot of lumbar and SIJ problems come from changes in the hip, mobility, strength, all the above. And if it was warranted and this person had a stiff joint capsule, which obviously you need to be there to be able to assess these things, would you have done anything different? If that were the case, I would have done the same thing. Now, what you don't know is why did it happen to the right hip and not the left? So there had to have been some pre-existing. So that's always the concern. So in hindsight now, maybe I would have had less of an amplitude on this adjustment, on the mobilization. But I think I still might have done it. So what's the lesson learned here? Short amplitudes, low intensity, as you get closer to the event is a better it's a better approach. It's a conservative, safer approach. Do no harm. That is your job. Don't be a superstar. You have rock star on one side of the bell curve, and you have conservative, do no harm on the other. How close to that aggressive part are you? And not every clinician thinks this way, right? They want to be the superstar. They want to be the game changer. And then you have people on the flip side who just want to do enough to say that they were there. I think there's a happy medium inside every opportunity that you have. If you're a sports PT now, or you're aspiring to be a sports PT, what do you take away from this, and how does this apply to your clinical practice? For those of you who work in a orthopedic setting or inside a more of a clinical setting, you may or may not find yourself in these opportunities. But if somebody says, I have a football game or I have a soccer game or whatever it is, and it's warranted, if it's close to the week of the event, I would highly advise you to proceed with caution. I wouldn't put yourself in a position where you risk a lot. I think the reward is very low relative to the risk. So I would rather be the clinician who they can consistently see before an event, and they produce good results, versus the other option is they're an outstanding physical therapist who they're super risky. They make me feel good, but on the back end, there's a risk behind that inherently. Maybe the patient doesn't know that. So what line do you want to ride? How risky do you want to be? If we're me now, and anybody that I mentor inside my academy, inside anybody that I have one-on-ones with, I would say proceed with caution. No need to be the superstar. I think that you produce consistent results over time, and that's what gets you that notoriety. Nothing wrong with occasionally trying these things and it works out. Good for you. I'm talking about across thousands of patients. I've been practicing 14, 15 years now. It's where do you want to sit inside that bell curve? Well, how much of a consistency do you want to have? Do you want to have the one or two stories that you flared people up and you'll always remember and always be remembered by? So those are the three case studies that I wanted to share. Number one, overhead thrower. Number two, sprinter. Number three, professional heptathlete with hip pinching after a caudal hip distraction. So this will help you, whether you treat pro athletes, novice athletes. The situation is very similar. You might see them a week before, 2 weeks before. So I say proceed with caution the week of. Anything outside of that, you have opportunity to fix them, put them in repair mode, whatever it is that you need. But on the week of the events, proceed with caution, especially if you're going to be treating the day of. Oh, be very, very careful. So this might be you volunteering at events, maybe a marathon, a 5K, whatever it is. Proceed with caution. I don't think it's necessary, but I think that if you have the skill set and you've had a lot of numbers and you've worked with a number of patients and bodies, then you can do your craft. But if you're unfamiliar with this, don't be the superstar. That's what I would tell you. And if you love these things and you're like, gosh, I want to get better at these things. This is what I want to do. I want you to consider joining my Sports PT Academy. This is where I can tell you, after having these conversations with my team, the PTs that I mentor, the reason why you need mentorship, the reason why you struggle is not because you don't have the skills, not because you don't have tools in your toolbox. I think how many CEU courses, how many things you've done. The difference between anybody that I mentor and the people who seek it out is they're looking for one thing, and that's critical thinking. The ability to navigate a situation and make the right decision and feel confident about it. But that requires a lot of insight into how you would plan, how do you prep, what are your risks, what's the plan A, B, and C, what are you looking for, and be able to navigate that inside in your head so you can do that in your sleep and be able to do that quickly. But most PTs doubt themselves. They doubt whether they should do it now. Is the time appropriate? Is this a clinical practice guideline? What does the research say? Some people take forever to make that decision. Others go too aggressive too quickly. There's a happy medium inside that. And the difference between very successful clinicians who can find themselves in pro athletes and pro sports and treating the people they want in the setting they want, the difference between these people, maybe yourself, is that it's just the ability to think critically on a regular basis versus just showing up to work, doing the damn thing, and then at the end of the day, not really reflecting, not really challenging yourself, and hoping the CEU course or a random certification makes you feel better. When in reality, you're going around the scenario, and the real root of it is you just need to think a little bit more critically, be able to develop a skill set that you can think for yourselves, and not depend on a mentor, depend on a course to teach you everything. The skill set is you, and the ownership is you. And the ability to do that requires that you put in the time and effort. And that's where I push anybody that I work with. That's where I'll push you. Because I can't be on the sidelines for you. I can't be in the clinic for you. But what I can do is give you the guidelines, give you the options, give you the scenarios. So that way you know what's going to hit you and you can make that decision and then reflect on that. Come back to me. What would you have done differently? What was the best thing about that? What went well, what didn't, and you just like being able to rationalize that. That is mentorship 101, not teaching you every mobilization possible. But what's it worth if you can't even know, you don't know when to do it? When would you have done it differently? What's that scenario? How far out? What's your risks? What type of a PT are you? Are you aggressive? Are you conservative? What do you want to be able to do? What outcome do you want? What does the patient want? There's so many scenarios. And if that's where you're at and you're like, gosh, I crave that. I want that. I have a mentor, but they're not doing it for me, or I don't have a mentor. I'm about to graduate. I've been practicing for years. I never considered that I needed a mentor. Everyone needs one. Every single human. And if you are about growing your clinical practice and your skill set and everything that you want to do, my Sports PT Academy is perfect for you. And I want you to consider that. If this is your 10th podcast, first podcast, 130th podcast with me, if you're not getting the mentorship that you need, now's the time. You're going to keep putting it off, and maybe next year, and maybe next month, or when my CEUs do this, and I don't like just keep making excuses. But ultimately, what it is just that you're putting off the inevitable. Yeah, either you're going to get good at your craft, or you're going to just keep saying that you'll do it one year. It's just the someday syndrome. Someday I'll do it. Someday I'll go to take this course. Someday I'll get a mentor. Someday I'll do academy. Someday I'll become a good clinician. And 10 years into your practice, you're still doing the same thing. So I hope that someday is coming up closer for you, or you have the resources that you need. So there you have it. There's the podcast to set you on the right path to ensure that you're not making the same mistakes that these healthcare professionals, to be successful in being able to help out patients and athletes at a couple different scenarios. So I hope that helps you inside your clinical practice. I hope you guys are doing amazing, absolutely crushing it, keeping your fitness and health high, and absolutely developing and crushing the confidence to be able to manage the people in front of you. So there you have it. I will catch you guys on the next episode. Take care.